In our American Voices segment this week, we hear from Pam Wall. Her goal, to eliminate the stigma surrounding mental health problems and mental health care.
Misconception, you have to be a combat veteran to have post-traumatic stress disorder. That's simply just not true.
Lieutenant Commander Pam Wall is a nurse with the U.S. Navy. Chances are you won't find her running an IV or distributing meds. She's a psychiatric nurse and a scholar with the Jonas Center, a philanthropy supporting the training and education of nurses in veterans' health care around the nation.
Often people who are coming back from theater with injuries will say, I don't want to be here. I want to be with my buddies in Iraq or Afghanistan because that's my family and that's where I feel very comfortable.
We caught up with her as she and her colleague, Commander Sean Convoy, taught a class on post-traumatic stress disorder to a group of nursing students at the University of Pennsylvania. Wall emphasized the clear connections she sees between nursing care and mental health care.
I think it absolutely makes sense that nurses do mental health work. Whether you are a mental health provider or you are a nurse in the OR, you're always doing mental health work. Always, always, always. It's never off your radar. It's something that's inherent in nursing across the board.
Wall says that while the traumas of war have been with us forever, the conflicts the U.S. is fighting today with an often unseen enemy cause unique stress on our fighting forces.
Pretend that it's 20,000 years ago and you're a caveman, you're hunting. Every once in a while you encounter a 20-foot grizzly bear, and it's scary, and you either fight it or you run from it. Well, what happens if you encounter that bear every day for the next 2 weeks or the next 2 months, and you're anticipating seeing that bear? So the human being is constantly on alert in that environment. When you take that service member out of that environment and put them back into a relatively safe environment, it's hard to turn that switch off.
You're always on edge. Your brain is constantly releasing that chemical. Your brain starts to change, literally. It starts to pick up certain cues that remind them of the grizzly bear. This is why when your veterans come back from war, they have a hard time driving, because what are they anticipating? IEDs. They swerve away from garbage on the side of the road because they think it's an IED. This is why veterans will go into a Walmart and automatically look for an exit strategy.
Those are normal responses to that traumatic event, and by no means does it mean that someone is broken or weak or crazy. It's an expected physiological response to a trauma. But nobody wants to raise their hand and say, hey, I've got a mental health disorder. Let's go talk to the shrink, or as we call them in the military, the wizard.
This is where nurses step in, says Wall, getting wounded veterans the psychological care they might need.
So in the military, they train our service members to have this idea that they are impenetrable or they are bulletproof. And sometimes that's difficult to approach the person with that warrior ethos, saying, okay, I see that there's something wrong, how can we help? And so I think one of the advantages of nursing is that because we are always with the patients on inpatient, outpatient, and they have an idea of what a nurse is, I think it helps us to readily identify some mental health issues, maybe before another person is able to identify it. And working with these people to get these people into care sooner is definitely a part of our care, something that we do well in nursing.